Hey, welcome back. This next video is going to discuss a very important chemotherapeutic agent named 5-fluorouracil. Now, if you have spent any time in a chemo room or have read or been around oncology, you've probably heard of this medicine. And if you haven't yet, it's something that you're probably going to see quite often because it's used for a variety of different cancers. It finds its way as a backbone in the treatment of colorectal cancer. And it's also used commonly in pancreatic cancer. It's used in cervical cancer. It's used in head and neck cancer. It's used in cervical cancer. And the list goes on and on and on. So we'll spend a little bit of time talking about this molecule. Now, 5-fluorouracil, similar to some of the drugs that we just got done discussing, cytarabine and gemcitabine, is a pyrimidine derivative or a pyrimidine analog. However, its mechanism of action is very different from the previous two molecules we discussed. Remember, gemcitabine and cytarabine have the ability to inhibit DNA polymerase in cancer cells, and it might also disrupt the overall architecture of the DNA, leading the DNA to break apart. And then gemcitabine can also inhibit that enzyme called ribonucleotide reductase. However, 5-fluorouracil actually works as a irreversible inhibitor of this enzyme that we've made mention of called thymidylate synthase. Okay. And remember, thymidylate synthase is what's responsible for catalyzing the formation of this DNA precursor deoxythymidine monophosphate from its precursor or starting material, deoxyuridine monophosphate. And recall that in order to convert the uridine into the thymidine, we need cofactors. We need that folic acid cofactor that serves as that one carbon donor only after it has been processed, though, by dihydrofolate reductase and serine transhydroxymethylase. Okay, so I need you to understand that 5-fluorouracil, once infused into the body and metabolized, is an irreversible inhibitor of thymidylate synthase, and it ultimately leads to this situation of thymidine starvation. Now, normally, and this mechanism here kind of goes a little bit beyond the scope of what we're trying to accomplish in preparing you as a pharmacist, but I like to think of you all as clinician scientists. So I want to just explain this normal formation of thymidine from uridine in the context of thymidylate synthase. All right. So I need you to pretend with me that up in this top left figure, figure one, or box one, what we have here is the active site of thymidylate synthase, and bound in the active site already is this deoxyuridine monophosphate. And then our good friend up here, N5N10 methylene tetrahydrofolate. All right, so this is the one carbon donor that we make from folic acid. Now, once those two molecules bind into the active site of thymidylate synthase, the enzyme is going to attack the uridine monophosphate with this cysteine residue in the active site. The cysteine residue, the thiol, will come up and attack the double bond, hitting the carbon at the 4 position. And when the cysteine attacks the carbon at the 4 position, the double bond that exists between the 4 and the 5 position in the ring, those pi electrons are going to come over and actually attack that methylene carbon. Right? That's the bridge carbon between the N5 and the N10 position. And that is actually the one carbon that N5, N10 methylene tetrahydrofolate is donating to uridine to make thymidine. When this attack has occurred, what you have is this transient bond between the enzyme, uridine monophosphate, and then the folic acid cofactor. However, when that bond attacks, it's going to cause, when those electrons attack, it's going to cause this bond between the methylene carbon and then the nitrogen to break. Okay. And then when that bond breaks, this is where the magic happens. It gets really, really interesting here. When that bond breaks, you have a secondary amine in the folic acid cofactor. That secondary amine is basic. It's going to strip off a proton from the 5 position in uridine monophosphate. When that proton leaves, it's going to leave a pair of electrons. Those electrons are going to collapse down into this bond between the 5 position in the ring and the methylene carbon here. So we're going to form a double bond here. And if we do that and we don't break another bond, we're going to violate the octet rule. So what happens is that the electrons that are forming the bond between the nitrogen in the tyrosine ring and that methylene carbon are going to donate back into the ring to reform a double bond. And guys, what that's going to do, it's going to kick off this hydrogen into the local environment as a hydride. Okay. So when that's all said and done, you end up with what we see in box 4. All right. The uridine has broken its bond with the folic acid cofactor at this point. And remember, I said we have this hydride just hanging around. Well, that hydride is going to come in and actually attack that carbon that was donated. It's going to actually reduce that double bond between the methyl group and the 5 position. That's going to force the pi electrons back down into the ring. And then that is going to cause the bond between the 4 position and the thiol to break. The electrons will go back onto the thiol, regenerating the active site in thymidylate synthase, and then releasing the product, which is now deoxythymidine monophosphate. And this can go on and participate in DNA synthesis. That's what's normally happening during the synthesis, the de novo synthesis of thymidine from uridine. Okay. Now, it's reasonable to think that if we can figure out how to block this, any step in this pathway, right? How can we block this? If we can block any of those steps in this pathway, then what we can effectively do is decrease the concentration of thymidine. And if we decrease thymidine, we decrease DNA synthesis, and then that's going to lead to cell death. And the most important part of this whole mechanism that I want you to reflect on or focus on as it relates to our topic of 5-fluorouracil is this step right here. All right. Because what we have here in this step, hold still, is a base in the form of this secondary amine and then an acidic proton, whereby the lone pair on that amine can pull off this proton and cause these electrons to fall into forming a bond between the 5 position and the methylene carbon. Okay. Remember that step, because now when we look at 5-fluorouracil and its mechanism of action, we'll see why that's important. On the left at the top, this is what 5-fluorouracil looks like in the vial that you would draw up from. Okay. This is what gets infused into a patient. And 5-fluorouracil, once infused, will undergo a couple different steps to activate it into 5-fluorodeoxyuridine monophosphate. So this is essentially a phosphorylation, a phosphoribosylation reaction, where the ribose and the phosphate are being added to the pyridine base. When 5-fluorodeoxyuridine monophosphate gets formed, it can find its way into the thymidylate synthase active site. And once in the thymidylate synthase active site, it's going to try and serve as a substrate for thymidine synthesis, just like uridine did. But instead of uridine, it is again 5-fluoro deoxyuridine monophosphate. What happens? Well, again, it's bound in the active site with its friend N5-N10 methylene tetrahydrofolate. The thymidylate synthase active site has got this thiol. That thiol is going to go up and attack the 4 position, just like we described on the previous slide. When it attacks that 4 position, the double bond here is going to go over and attack the methylene carbon, just like it did in the previous slide under the normal synthetic route. That's going to cause the breakage of this particular bond, analogous to what we just described. But what happens after that? Remember, once that bond is broken, you generate this basic nitrogen that has the capacity to serve as a base. And that base is what's responsible for pulling off the proton. But that proton doesn't get pulled off, does it? And we'll talk about this in a second. Okay, so remember, the most important aspect of the formation of thymidine monophosphate from uridine monophosphate enzymatically involves this basic amine pulling off this proton from the substrate and then allowing those electrons to collapse into this double bond that gets formed between the uridine and the methylene carbon, and then the breakage of this bond between the methylene carbon and the tyrosine ring, right? This is important. And why is that important? Because when we talk about the mechanism of action of 5-fluorouracil, you're going to see that 5-fluorouracil, after infusion, after activation, occupies the same site in the enzyme that deoxyuridine monophosphate occupies. And the enzyme is going to try and process that drug in the exact same manner as it would deoxyuridine monophosphate. Now, here is what 5-fluorouracil looks like in the vial, the 50 milligram per ml vial that you will use in your regimens. And 5-fluorouracil is just the pyrimidine base. After infusion, 5-fluorouracil will circulate through the body, find its cells of interest, get taken up into the cells of interest, and then get metabolized, essentially undergoing phosphoribosylation reactions, whereby the phosphate and then the deoxyribose get attached to the pyrimidine ring. And once that is complete, we have formed 5-fluoro deoxyuridine monophosphate. This is the substrate that will fit into the active site of thymidylate synthase, along with N5-N10 methylene tetrahydrofolate. Thymidylate synthase with the same thiol group in the active site will attack 5-fluorodeoxyuridine monophosphate at the 4 position. Remember, that's going to cause the pi electrons to form a bond between the uridine monophosphate analog and N5-N10 methylene tetrahydrofolate. That will cause this bond between the N10 position and the methylene carbon to break. This is what then leads to the formation of the basic amine. And remember, this basic amine wants to pry off this proton in uridine monophosphate, but you can see it's no longer a proton, it's a fluorine. And it's a fluorine attached to the 5 position in the exact same spot that the proton would have been attached to. Now, given the positioning of fluorine on the periodic table, you know that it is highly, highly electronegative. It's very, very difficult to remove a fluorine from a carbon in a drug molecule. In fact, we actually use fluorines as protecting groups for certain carbons in certain drugs to prevent them from getting oxidized. As such, the basic amine, no matter how basic it is unable to remove that fluorine from the 5 position. And if the fluorine can't be removed, everything stops. Right? Thymidine synthesis stops at this point because the amine is unable to grab and remove the fluorine. And you are left with an irreversible or covalent modification, thereby suppressing the activity of thymidylate synthase and then decreasing deoxythymidine monophosphate production, and that's going to decrease DNA synthesis. Okay. Okay. This drug, while widely used, is also fraught with a lot of toxicities. The usual toxicities that you would expect, including nausea, vomiting, and diarrhea, are noted for 5-fluorouracil. 5-fluorouracil also has some bone marrow toxicities as well. It can cause neutropenia and leukopenia, as well as low platelets or thrombocytopenia in a wide variety of patients. A lot of it has to do with the regimen that they're on, but nonetheless, it can happen. And it's somewhat protracted as the nadir or the lowest point of those white counts and other blood element decreases occurs anywhere from 9 to 14 days after the regimen. And then what we've also noted with 5-fluorouracil is that the propensity to cause certain toxicities is largely dependent on the route and rate of administration. So if we give 5-fluorouracil as an IV bolus and we achieve a very rapid peak, and then it comes down over a certain amount of time, this bolus dose is associated with hematological toxicities. And then infusions which hit a particular concentration and then remain there for a period of time tend to cause something called hand-foot syndrome. When there's a medical term for hand-foot syndrome, it's palmar plantar dyserythrodesia or something to that effect. Really, what you see is the patients who are getting these infusions tend to have peeling, redness and peeling of the palms and the soles of their feet. Okay. And if you administer 5-fluorouracil as a prodrug orally, that's going to mimic then the adverse effects that you see with the infusions, right? Hand-foot syndrome. There are some other toxicities that can be grossly exaggerated in certain individuals who have deficiencies in metabolizing enzymes. So this is where the pharmacogenomics aspect of cancer becomes a little bit more interesting. Now, typically what you'll see with a fluorouracil regimen is maybe a bolus dose of 400 milligrams per meter square on day 1 and or day 2, and then a prolonged infusion where the patient's getting like maybe 2.4 grams per meter square infused over 48 hours. So naturally, a good part of that 5-fluorouracil is going to get taken up into the cells of interest and exert its mechanism. But this leftover 5-FU that doesn't get taken up into the cell needs to go somewhere. The body has to do something with it. And one mechanism that the body has to metabolize and inactivate 5-fluorouracil is through an enzyme called dihydropyrimidine dehydrogenase. Okay? And dihydropyrimidine dehydrogenase is actually a reductive enzyme. And when 5-FU finds its way into the active site of this enzyme, it will actually reduce the double bond between the 4 and the 5 position to give you this fluoropiperazine intermediate, and then an enzyme called dihydropyrimidinase can actually cleave the ring. It can open up the ring and afford you with an inactive metabolite called fluorouretopropionate. Right? Fluorouretopropionate. And fluorouretopropionate can actually get broken down even further into an amino acid. And then this fluorobeta alanine. And concerningly, this fluorobeta alanine, when it accumulates, can be toxic. Okay. And we don't see that too often, but what we can see is individuals walking around in society that have a genetic alteration whereby they are poor expressors of that dihydropyrimidine dehydrogenase enzyme. And a deficiency here, coupled with usual and customary doses of 5-fluorouracil, can actually predispose individuals to severe adverse effects from 5-fluorouracil. Not so much just the cardiotoxicity here, but we're actually talking about having the drug stick around in the body a lot longer than it should. This can increase the risk of bone marrow suppression, and it can increase the risk of CNS toxicities as well. Now, we certainly can look for this deficiency preemptively and identify individuals that are at increased risk and maybe even adjust the dose, but in reality, it's not being done that way, and it's more reflexive. When we see an individual who has adverse effects that kind of go beyond the scope of what is usual and customary for 5-FU infusions, that's going to trigger the investigation into the genetics and then the subsequent dosing modifications. All right. And then one last thing I want to make mention of is I said an oral form of 5-fluorouracil. Yes. So there is a drug that is out on the market that's used in colon cancer regimens. It's called capecitabine or Xeloda. Comes in tablets. And these tablets are taken orally for the purposes of, again, of colon cancer and maybe a couple other cancers as well. But nonetheless, I want to show you how Xeloda or capecitabine as an oral prodrug makes its way into 5-fluorouracil. It's kind of interesting. Here's what capecitabine looks like as the parent molecule. And you'll notice you've got this methylated pyran ring. You have a carbamate here. And then in the middle is that pyrimidine ring that we're used to seeing. Okay. Now, what happens to this molecule after oral administration? Well, when it gets absorbed and taken into the system, of course, the first organ it's going to see is the liver. And in the liver, we have esterases that are actually going to enzymatically remove this methyl ethyl propyl butyl pentyl, this 1, 2, 3, 4, 5 carbon chain. That 5 carbon chain there again is going to be there to prevent premature metabolism and enhance lipophilicity. Regardless, what we end up with is the equivalent then of a cytidine analog, right? And if you think back to infectious disease, remember we said that fungi have an enzyme called cytosine deaminase, and we don't, but we have a cytidine deaminase, right? And cytidine deaminase is going to accept this molecule as a substrate, and it's going to deaminate this position on the ring. And it's going to convert it to the equivalent uridine analog. And then an enzyme called thymidine phosphorylase will remove that. I might have said pyran, but it's a furan ring. Remove that furan ring from the pyrimidine. And what are we left with? After all of this, we have 5-fluorouracil. Okay. 5-fluorouracil then will get enzymatically activated by the addition of a deoxyribose and a phosphate to afford us with 5-fluorodeoxyuridine monophosphate. And then this is the molecule that will go on to inhibit thymidylate synthase. And then that will decrease DNA synthesis. Right? So this is an oral formulation of 5-fluorouracil. All right. That's all I have on 5-FU. We will talk to you guys soon. Thank you.